how does removing ovaries surgically affect your hormones? I just had a patient this week. She was 42. She had a hysterectomy with a bilateral salpingonephrectomy when she was 35. She had 7 years of hormone deficiencies. The doctor never even suggested to her to take hormones. She was a mess. I mean, she couldn't have intercourse. She couldn't sleep. She was affected in such a way that she lost her job. She hardly had a relationship, intimate relationship with her husband. So again, surgical menopause is a serious stoppage of all sex hormones at one particular time. And the fact that she received no placement at all, well, no replacement at all, to me was very bad. And she was a mess. And she was told by her doctor that she needs to see a psychiatrist because obviously there's something psychological. So let's refer to that one statement. When in 1940s, when diabetes was rampant, but they had no insulin, and during World War II, these patients were hospitalized for diabetic encephalopathy. Very fascinating articles were written at the time when insulin became available after World War II, when they started checking blood sugars. And 30% of all hospital inpatient for psychiatric illnesses found to be diabetics were given insulin and released. So I find it really fascinating that 100 years later, or 80 years later, we have the same situation, that women are treated psychologically when indeed they have a physical deficit, which means sex hormone deficiency, similar to the diabetics in the 1940s that were deficient in insulin. It's amazing how medicine as an institution did not learn from that and understand that women are not crazy when they're having symptoms. They know their bodies. It's crazy to say to them that they're crazy instead of finding out what it is that's being deficient, in this case, sex hormones.